Hi, Don here. Welcome to the Million Dollar Minute. We're going to go over the numbers from a Friday here. And this is a day that I had a half day because it was the first Friday of each month. We have an office meeting, so all my office staff, they get together for that second half of the day. And the doctors, we play hooky. Actually, one of the doctors usually participates in the office meeting, and the rest of us just do other things. So the day was pretty normal here. Let me go through some of the highlights. There was a couple of comprehensive diabetic foot exams, so I did that. There was another patient that came in. This is something that didn't go right. I always like to go over what went well and what didn't well. This is a 66-year-old man that came in, and he had some toe pain, and the staff did not get a x-ray. He had an exostosis, kind of a callus on the side of the toe. So if I could have done it over again, I would have had them get x-rays. They tend to do pretty good at getting x-rays. Even though I'm not going to remove that exostosis right now, I just recommended more anatomic shoes. It might be something we would do in the future. But to correct that, I always, whenever there's pain, patients with pain, I have the staff get x-rays. Other patient was a 69-year-old female that had an IND, and this was kind of interesting. She had on her fourth toe kind of a big swollen mass, and I was planning on just doing an IND on the side, but it ended up being an epidermal inclusion cyst, I think from a previous matrixectomy. So I had to, just like a big piece of nail that was stuck inside there. It didn't even look like nail, it just kind of looked like matrix, like the white part, and then I pulled that out and drained it. So that was kind of the more fun one of the day. And then the other patient, there was an IND patient of the nails, of the ingrown toenail. The other kind of things I did on this day, because I had a little bit of time, I took a call from a patient. This is a patient of a colleague of mine. There's another doctor around, and he treated this young boy and didn't really do anything. So this is kind of the qualm. The mom came in, 5-year-old boy, had an ingrown toenail, was painful, and the doctor, which is probably recommended, he recommended a matrixectomy, but the kid just couldn't tolerate the injection. So I don't know how many of us have had that. I think all of us have had these kids that just can't tolerate it. And really, I just talked. She was wondering, and she called actually wondering if we did laser toenail removal. And I was like, well, that's kind of a neat idea. We don't. I don't think you need it. I think you need your toenail numbed up and the edge of the nail out. And if that doesn't work, or if you can't tolerate the injection, then you do a slant back. Just kind of, we all know what that is. But I think she was appreciative of that help. And I think even just getting a doctor on the phone, I think it sets us apart a little bit. Whereas many times we make ourselves so unapproachable. But when the staff got the call, I just said, just transfer over to me. I'll answer the question. So even if I don't get her as the patient, because I did encourage her to go back to her own doctor that she was seeing, I think it'll be good for goodwill, and maybe she'll come in the future. The other thing that was kind of interesting for the day is I was thinking about how I can get in front of more primary care doctors. And I know this is a struggle for all of us, and I'm thinking more about it right now just because the winter time's a little bit slower. And I pulled up this list of all my primary cares, and I have this list. I can show it to you if you want. I did it within Athena. And actually, by the way, I did make a couple of Athena videos. As I'm exiting Athena, I'm wanting to document some of the great things I've found with Athena. One was a follow-up visit. So if you look on my YouTube, there's going to be like Athena best reports, or Athena. It's in my Athena videos, the most recent one. There's about follow-up patients, one based on diagnosis, one based on high value patients, and then another report based on referrals. And this is the referral one that I was noticing, because with this referral, I can see how many referrals, or actually how much revenue we got from each referring provider. So this is something our EMR does. And now, granted, maybe it's not those doctors that are referring everyone, but they are their patients. So basically every patient has to have a primary care doctor, and then so we can track it to them, even though they might come from a referral from a friend, but it's really the primary care. And my thought is, well, how how is it that, like, let's say one doctor, we get $90,000 from this one doctor, and this other doctor we get $20,000? Well, it's probably because the patients are coming on their own or from referrals from others and not that doctor referring to us. So how can we get in front of that doctor and have that doctor refer only to us, like the ones that refer over $90,000 a year? And that's that's kind of the nut that I've been trying to crack and trying to figure out how to do this. And I was thinking about this, and I tend to find if I have struggles, I like to journal. I like to journal about like the one focus. And I tend to find one of the problems that I have is I tend to get distracted. Like today I'm going to be interested in this referral thing, and then tomorrow I'm going to be distracted on this other thing. I found that what helps me a little bit stay focused is this one-page report that I do each month. And the things I'm planning on doing would be going through my main avatar with a $100 million leads book, and then making a web page for second opinion. So like those are the things I said I was going to focus on. And I tend to, even though I wrote that, I still get distracted on these other things. And I don't know, this is probably, I think, a way a lot of us are. We get distracted by these bright, shiny objects. And I heard this from someone before. What tends to happen is the beginning of something is always more interesting than the hard work to bring it to fruition. And this is something I want to confess that I think I've been a product of over and over and over again. So let me just give you an explanation. So I am a person that likes to create things. I think I like to create, I like to invent, I like to develop. So to that end, I've made a number of books on plantar fasciitis. I've made a number, like this new thing, this foot pain analyzer. I've made a lot, like everything else. But the problem is, and this is an error that I have, so maybe you guys can feel the same thing, or maybe you're better than I. If you know how to fix this, tell me. But what I find is that I make these things, but then I don't go all in on marketing that one thing. Meaning, let's say I'll make this foot analyzer and I don't go deep with it. I make it, put it up on the website, and I leave it at that. Whereas I tend to find that the one thing that does better for me is when I consistently continue to offer it, make different ways to show it, make different ways to utilize it, make different ways to improve it. There are a few things that I have done that with, and they've worked substantially better, such as my patient presentations and my treatment sheets and things like that. They tend to, I've perfected them and I've continued to use them, and it's brought in more value. So anyway, those are just, I always like to share kind of what are the good things and what are some of the bad things. So what I'm going to do based on this is I'm going to focus on more of these things, focusing on the things that we're going to move the practice forward, such as the referral doctors. Because there's a good book called I think it's called The One Thing. And so if you think, like, what would be the one thing that would make all other things irrelevant, and then just kind of focus on that. And so for me, the one thing that would make all things irrelevant would like an infinite amount of referred patients from other doctors. And the only way I'm going to get that is if I have really deep relationships with these doctors, or I'm constantly in front of them, or I don't know. Because I have a couple of them, but I don't have all of them on the list. Like it's 20% bring in 80% of the referrals. So that is kind of the focus right now. Anyway, hope you guys found this beneficial. It was a little bit of a rant today because there weren't that many patients here on Friday.